You guys ready to learn about multiple sclerosis? Multiple sclerosis. It ain't no simple thing, pretty severe it tends to be for a disease of the brain and the spine and the arms and the legs and the eyes. Yes, it's the disease, but it's like a cancer on your life. Now some of you are asking me, well, how does it work? Give me a minute, I'll explain it using no confusing terms. In other words, the way it works, it isn't simple at first. I'll break it down in a verse and hopefully you will learn. There's a substance called myelin, remember it well. It's rather important to the survival of your brain cells. If T cells are like weapons for the immune system to use, then myelin's the equivalent of your nervous system shield. I'm sure you know inside your brain are many neurons interconnected by a web of paths. Those are called axons. They're what transmit signals from point A to point B, and surrounding the axons is where we start to see the myelin. It surrounds them fully. It gives them some protection from the interneuron bullies, and you've made it this far. I'm glad that you've been patient. This is where we talk about the demyelinization. What? Now stick with me here. I know it gets confusing, and from here it's pretty weird, but it's simpler than you think. You don't have to reach far, because multiple sclerosis literally means many scars. Scars are what follow when the axons get demyelinized. They make the signals blurry, and it could lead to foggy eyes and tingling, or maybe sharp pains, unceasing, relentless. It could go on for days. You could lose control of your bladder, urinary incontinence. It could even lead to partial or total paralysis. The number of symptoms, man, I couldn't even list it. On top of that, none of it could even be predicted. You don't know what's gonna come until it's already been through. And I forgot to mention that it's incurable too. So let's get this straight. Nobody knows if you're gonna have it. Even if they do, then nobody knows what's gonna happen to you. And when your panicking becomes a force of habit, your mind will be consumed by thoughts about having another attack in its back, and it works like that. Once the scars start forming on your nervous tissue, sometimes you won't notice it, but occasionally it just will hit you. The length between attacks, of course, can vary case to case, unless, of course, you get the case that just worsens day after day. Think about how scary that must be to suddenly be diagnosed with an incurable disease, and you will never know the threat or the severity, cause once you hear the news, your mind can never truly be at peace. Never. I'm not done. Hardly even started. So, I've talked about what it does, I've talked about the symptoms, I've talked about the never-ending suffering of its victims, but let's talk about how you transfer this disease. The answer lies mostly genetically. The answer why the T cells ever attack the myelin. The answer why MS is so typically violent. Normally your chances are 0.10, just about the same chances as you being a superhero. But if one of your parents had it, your chances jump to 1%, and if an identical twin has it, your chances get multiplied by 10. So recap, literally anyone can get the disease, but your chances are increased with a genetic history. Now that we've discussed the stuff about how it might be transferred, now let's talk epidemiology. Handle this in a gentle manner. This is serious, don't shake it, don't play pretend. Like the fact that it affects women up to 3 times as much as men. It's really strange, I don't know how much to stress this. I didn't even know that a disease could be so sexist. Not to mention that it also factors race, affecting whites slightly more than blacks, varies case to case. And by far the strangest fact about your chances of contraction has nothing to do with your life or your cultural faction. I kid you not, really. I'm saying this verbatim. Your chances go up the farther north you live from the equator. Enough about that. Let's talk about the treatment. We've got many drugs out there, but we've got nothing that can beat it. We've got supplements to help patients try to get what they lack. Remember when I said that MS comes in attacks? Periods of times when the symptoms become acute. Well, in that case, steroids can be used to help soothe. Let's be clear, it makes it shorter. It does not prevent, takes what would be a lengthy to a slightly shorter event. The myelin gets attacked when the immune system acts up, so another common form of treatment is immunosuppressive drugs. Another drug used to slow the myelin's decay is cortisone, which pretends to be the prey. The immune system will go for anything it has regarded as bad, so cortisone, it pretends to be the target. Another common treatment is the use of interferons, proteins that we grow so that we know what they'll adhere on. Tranquilizers, paralyzers, anti-seizure drugs, ADHD medication, whatever we can flood into their systems that'll help. Close your eyes, point your finger at the shelf. Try it. Does it work? No? Oh well. Maybe next time. This certainly isn't swell. Not to mention, most of these medications have side effects so severe that they're not even recommended. Don't you think that that's a little weird? If you ask about alternative treatment to help the fight, your doctor basically will say whatever helps you sleep at night, as long as it doesn't kill you, as long as you keep eating right, as long as you don't stop the treatment that we've prescribed. Let's be honest. Honestly, we can't really do much. It's been around for 200 years, and that whole time we've been stuck. Yes, in recent years, the hopes have been looking up, but if you or anyone you know has it, I wish them good luck.